Hi, this is Dr. Ron Klatz for Immortality Now. I'm here with Dr. Jeffrey Dash from Fort Lauderdale, Florida. Dr. Dash is an expert in many aspects of anti-aging medicine, hormone replacement therapy, expert in heart disease, and his new book, Cracking Cancer Toolkit. Very impressive. And we have a special guest, Carol Peterson, a pharmacist. Carol is well known to many members of the Academy, many members of the alternative medicine community, and many members certainly of the conventional medical community. Thank you for being with us, Carol.
Thank you. I'm so privileged to be here.
Yes, you are. But Dr. Dash is very well known. So tell us about your new book on cancer and what you think are some of the new breakthrough therapies that you've discovered.
Well, the book highlights the idea of using old repurposed drugs as part of cancer treatment. And one of the drugs that we were just discussing earlier over dinner was itraconazole, which is the old antifungal drug, Sporanox, which has been around for a long time, and the recent studies by Sarah Head and published in 2015 show, using fluorescent probes, that itraconazole actually attaches to the Achilles heel of the cancer cell, which is the voltage-dependent anion channel called the VDAC on the outer mitochondrial membrane, where it separates the VDAC from the hexokinase 2, which is an embryonic form of the first enzyme, which is the first step in the metabolism of glucose. So this is a highly potent anti-cancer strategy, which throws a monkey wrench into the metabolism of the cancer cell. So, and again, the concept is cancer as a metabolic disease. So that's what we talk about in the book, looking at cancer as a metabolic disease and how to use repurposed drugs to throw a monkey wrench into that process.
You
Carol,
also
you're going, Carol.
you also include in your book many references to the herbal world, and we just talked about having like a choice of 300 drugs, repurposed drugs to use for cancer therapy, but you said the choices of plants run more like to 3,000. Could you touch on some of those very important plants for cancer therapies that you describe in your book?
Well, one of the plants that we were talking about earlier, which is highly effective, is the cannabis plant, among others. And the non-psychoactive component of cannabis, of course, is CBD, which stands for cannabidiol, which was studied by Rimmerman in Israel, showing that CBD also, very similar to itraconazole, detaches hexokinase 2 from the VDAC, which is the Achilles heel of the cancer cell. There have been a number of case reports showing remission in leukemia patients and remission in other types of cancers using CBD. These case reports have been written up in the medical literature. Of course, there are lots of other anecdotal reports, but when it's written up by medical professionals in the medical literature, that I think that is especially noteworthy.
So how did you come to write this book? What was your inspiration in the first place? This is your third book now. You started with hormones and then heart, which we could discuss a little bit too. But cancer, it's like your magnus opus here.
Well, I wasn't really intending on writing a cancer book, but what happened was, over the last 5 years or so, three members of my family came down with aggressive cancers, and so I was, out of necessity, forced to study the issue, and I realized that a lot of the medical literature was highly technical, and there was a certain amount of cancer jargon that had to be learned. For example, just the word VDAC, VDAC, it stands for this long phrase called voltage-dependent anion channel, and so there are a lot of these little phrases and concepts that are part of the new molecular biology of cancer, and that has to be assimilated like a foreign language. So that was the first step, and then I started writing about cancer in my newsletter over a few years, and then after 3 or 4 years, I realized that I'd accumulated so much material on cancer that I should put it together into a book, and that was the genesis of Cracking Cancer Toolkit, the book, which ended up larger than I actually intended. But getting back to what you said, Carol, about 3,000 plant species, one of the big lies about cancer comes out in the movie Medicine Man with Sean Connery and Lorraine Bracco, which was one of my favorite movies. I think it was 1972. Sean Connery plays this biologist in the Amazon rainforest, and he discovered this rare flowering plant that was the cure for cancer. He uses the substance to cure cancer in one of the tribal children, and what the movie comes out with is the idea that's what I say is the big lie, that there's the only cure for cancer is some rare, obscure flowering plant in the Amazon rainforest. The reality is there are 3,000 plant substances known to have anti-cancer activity. And if you look out your window at the landscape at your neighbor's garden, chances are you're going to be looking at some plant that has anti-cancer.
And how many of these cancer therapies are being used in traditional or being used by conventional medicine? I don't want to say traditional.
No, it's really conventional.
Yeah, conventional medicine, is drug-based, as you know. So the answer to that is
zero. Maybe one.
It would be highly unusual for that to happen. But it's we talk about conventional medicine, which is based on the chemotherapy paradigm. In the first few chapters, we go over that, and some of the problems with chemotherapy. It's outlived its life expectancy, and the problem with chemotherapy is that the chemotherapy, number one, does not attack cancer stem cells. So what happens is the stem cells are left behind after chemotherapy treatment, and that's the cause for cancer relapse. The cancer stem cells regrow and create a relapse. The second problem with chemotherapy is it actually increases the numbers of cancer stem cells because chemotherapy stimulates inflammation. And when the cancer does come back, it's more aggressive and many times chemotherapy resistant. So even cancer researchers nowadays have openly admitted that we need a new paradigm. We need something, and the new paradigm is already here with repurposed drugs that have been repurposed as anti-cancer agents.
And name a few of those drugs.
A couple of the drugs, such as itraconazole, fenofibrate, metformin, doxycycline, some of the antibiotics. Many of the antiparasitic drugs have anti-cancer activity. Ivermectin, which is also an antiviral drug, is used by millions of people in third world as an antiparasitic drug for river blindness and other devastating parasitic diseases. Niclosamide, which is an antiparasitic drug for hookworm, is also a very potent anti-cancer drug. Parvinium, which is another commonly used anti-cancer drug, antiparasitic drug, no longer used in the United States, but used throughout Europe. And then the mebendazole, which is an old antiparasitic drug, is also a microtubule agent. The cousin of mebendazole is fenofibrate, which was widely publicized by Joe Tippins, the Joe Tippins protocol. He was a Oklahoma rancher, businessman who developed lung cancer, treated at the Mayo Clinic, and was just given a poor prognosis by the doctors and sent home to die. A friend of his who is a veterinarian called him and said, "Hey, you should try this antiparasitic horse medicine used by veterinarians. It's an antiparasitic. And 3 months later, he was cancer-free, and his doctors were astonished.
So this all seems to support the immunological basis of therapy for cancer. Because, it's not the cancer is being caused by a worm or a bug per se, but by an immune failure.
The immune system is in the cancer. The theory of cancer, the immune system is huge because one of the things that cancers do, which is very well known, is cancer turns off the immune system. It's called immune evasion, and in order to successfully treat cancer, we have to address the idea of restoring the immune system, and that's the basis for the new immunotherapy drugs, the checkpoint inhibitors, which of course have revolutionized medical treatment for cancer. Unfortunately, they don't work for everyone, and there are a lot of resistant cases. So we do talk about the checkpoint inhibitors in the book and how to enhance the efficacy of checkpoint inhibitors. One of the things that will do that is, surprisingly, I was surprised to find out, is probiotics. That was one of the huge surprises of immunotherapy, is the patients who had been treated with antibiotics and had destruction of their microbiome from antibiotics did very poorly with the checkpoint inhibitors, while the patients with the best microbiome diversity tended to do the best with the checkpoint inhibitors.
What other things can the listener apply to their own life with the prevention of cancer? I mean, there are, it's not just drugs anymore. It's a lot of natural substances. It's a lot of lifestyle intervention. And certainly cancer is becoming a more critical issue, because in the past it was maybe 1 million deaths a year from heart disease and 650,000 deaths from cancer. But now they're pushing the same. 1 million deaths from cancer, just slightly over 1 million deaths for heart disease. So cancer is really picking up in the environment. What is it that you've discovered that can protect you or prevent you from succumbing to cancer?
Well, we have a cancer prevention protocol in the office. We actually test for vitamin D, selenium, and iodine levels. And when these are found low, we supplement with vitamin D, selenium, and iodine. It's been very well established in the medical literature that vitamin D deficiency is associated with increased cancer risk, also autoimmune disease risk. And just by raising vitamin D levels, you can achieve cancer prevention or reduce the risk of cancer. Iodine is huge as a breast cancer preventive, and that was, of course, popularized by Dr. David Brownstein's work on the iodine project. Dr. David Brownstein is actually one of my mentors, and I learned a great deal about iodine listening to his lectures and his books. So we do test all patients for iodine level and give iodine supplements. Selenium is huge as an anti-cancer preventive. The NPC study showed that people with low selenium levels had tremendously increased risk for cancer. We know that selenoproteins are involved in cancer surveillance and DNA repair. Damaged DNA is repaired by the selenoprotein mechanism. So people with low selenium tend to have increased risk for cancer, and simply by supplementing selenium back to normal levels, you can reduce cancer risk in the population.
What about garlic?
Garlic, we did mention garlic as a antimicrobial agent, and also other very, very beneficial health effects. In terms of anti-cancer effects, it's very healthy to take extra garlic, but the selenium. I think the selenium, vitamin D, and iodine are probably higher up on our priority list.
And sulforaphane.
Sulforaphane is an excellent anti-cancer agent.
Right. That's from broccoli sprouts.
Broccoli sprouts, and that's recommended as a breast cancer preventive, also for prostate cancer.
Sunshine?
Sunshine.
Vitamin D, yes.
But is sunshine effective in and of itself, or is it the effect of sunshine on the skin increasing vitamin D?
It's the increasing vitamin D, exactly. And the studies show that people who live closer to the equator and get more sun exposure have there's less incidence of cancer geographically. Higher latitudes with less sun exposure will have higher incidence of cancer and also multiple sclerosis from vitamin D deficiency.
Why don't we shift over to your heart book?
Heart book.
As
Yes.
a radiologist, you developed a plan to evaluate people for their heart attack risk or heart disease risk, and then you have gone in your book. I liken it to a cookbook for patients. It gives you very good instructions of what to look for, and then a list of possible remedies for the situation. And would you like to give us a short synopsis of your heart book?
Well, thank you for bringing it up. The heart book is the genesis of heart book is as an interventional radiologist, I did vascular radiology. I studied atherosclerotic vascular disease for most of my career. Doing angiograms, doing imaging of the arteries, looking at plaques, and using balloons and other interventions to open up arteries in the peripheral vascular system. During all the time I worked in the hospital, the prevailing theory was that cholesterol was the culprit in causing atherosclerotic vascular disease, and I was really never completely satisfied with that explanation. And when I left radiology and started my own practice and started studying the issue, one of the things that came to the forefront was a new imaging technique called the calcium score, which I actually, during part of my career, read calcium score studies. And it's a CAT scan through the chest, which images the coronary arteries and measures the amount of calcium in the coronary arteries. So the calcium score, the total amount of calcium, actually correlates much more accurately and strongly with atherosclerotic cardiovascular disease risk, and can predict those who will have a heart attack. And it's much more accurate and sensitive than the cholesterol panel, which really is not very predictive of anything. So that really convinced me that there is another answer here, that the cholesterol is not really a good answer for what causes heart disease. So then I started looking at, well, if calcification is the actual disease process in the artery, what is causing the calcification? And the new research using 16S ribosome technique, which is a microbiology technique to demonstrate bacterial organisms in pathology samples, that this new technique shows that atherosclerotic plaque in using the 16S ribosome technique is actually infected polymicrobial biofilm with multiple organisms, and they're able to demonstrate that very nicely. So this all comes together very nicely as a form of infection, and the infection is coming from either the oral cavity, dental problems, dental infection, or from the gut. When an infection comes from the gut, it's called leaky gut. And of course, we know that the average person walking around has a low-level endotoxemia. There's a certain amount of gram-negative endotoxemia in the blood of all of us as we walk around. Diabetics tend to have higher levels of endotoxemia, and that explains the higher risk for our heart disease in diabetics and greater mortality in diabetics. Those are some of the things we talk about in the book. In terms of treatment programs, we use natural substances. One of the things Ron mentioned is garlic, which is antimicrobial and is very effective at reducing coronary calcium score. And and of course, addressing leaky gut with diet and lifestyle changes is also very important. One of the things that causes leaky gut, which is very well known, of course, a certain segment of the population is sensitive to wheat consumption, and most of this work was done by Alessio Fasano, who's from a pediatric gastroenterologist who is now at Harvard, and he did the original work showing that wheat proteins cause leaky gut, and this causes a little endotoxemia, which then seeds infection into the endothelium.
Dr. Dach, we're running out of time. It's fascinating stuff. We could go on for hours. But in the last couple minutes, maybe you could just tell us what you found to be most effective in regard to your anti-aging medicine programs. Because after all, this is Immortality Now, and what we want to know is how are we going to affect longevity? Of course, beating cancer and heart disease are critically important, but beyond that, what is your three strongest recommendations?
Well, I always love to get back to the thyroid hormone as one of the top on my list as an anti-aging intervention. We know from going way back to the 1890s, thyroid pills, in terms of one of the first medications, one of the first medicines made available was thyroid hormone back in the 1890s, and we have old photographs of patients before and after thyroid pills showing dramatic rejuvenation type appearance, where somebody who looks quite old in appearance with a low thyroid condition, after giving thyroid medication a few weeks or months later, they have a much younger appearance. So, and that if you look at the mechanism of thyroid hormone, it's the increase in size and number of mitochondria, and so that brings us to the mitochondria theory of aging. We're improving mitochondrial energy production, and so yes, that any intervention that improves mitochondrial energy is going to be an anti-aging intervention. So, what are the other things that do that? Simple vitamin interventions. For example, alpha-lipoic acid and thiamine are two key vitamins for mitochondrial function. They will synergize with the thyroid medication. Coenzyme Q10 is also a very nice anti-aging intervention because that improves electron transport chain in the mitochondria. And then, on and on. There are many other mitochondrial interventions, of course, but that's just to scratch the surface.
Well, thank you very much, Dr. Dach. Really a pleasure. Congratulations on your books. They're very well written, and I do recommend them for the American Academy of Anti-Aging Medicine and for Mortality Now. I'm Dr. Ron Klatz. Carol, my co-host, thank you for being with us today, and thank you for those good questions. And we hope to speak with you again sometime in the near future.